1. A newly certified dialysis technician is struggling with documenting patient assessments accurately. As a mentor, what is the most appropriate first step? A. Provide written documentation guidelines only. B. Assign the technician to a different mentor. C. Observe and review their documentation in real time. D. Report the issue to human resources. 2. During a clinical practicum, a student fails to perform hand hygiene before initiating dialysis. What is the most effective instructional response? A. Ignore it since it's only training. B. Pause the procedure and initiate a teachable moment. C. Report the incident to the regulatory board. D. Have another student complete the procedure. 3. Which principle of adult learning theory is most applicable when training experienced CNAs transitioning into dialysis roles? A. Dependence on instructor-led training. B. Use of rote memorization techniques. C. Leveraging prior knowledge and experience. D. Structured, passive lectures. 4. A dialysis technician trainee shows anxiety during patient care simulations. How should a clinical instructor respond? A. Remove the trainee from the rotation. B. Increase the complexity of tasks to challenge them. C. Provide supportive feedback and build confidence through repetition. D. Ignore the emotional response. 5. What instructional strategy best supports kinesthetic learners in a dialysis technician training course? A. Reading medical textbooks. B. Attending online lectures. C. Participating in hands-on simulations. D. Listening to audio recordings. 6. Which of the following best demonstrates compliance with CMS regulations for patient care in dialysis centers? A. Using uncalibrated equipment for speed. B. Documenting vital signs after every session. C. Allowing patients to determine their own dialysate composition. D. Skipping machine disinfection if the patient appears healthy. 7. A technician receives unclear verbal instructions. What communication strategy should be used to ensure accuracy? A. Ask unrelated follow-up questions. B. Use closed-ended questions only. C. Paraphrase and confirm the instructions. D. Avoid clarifying to appear confident. 8. How should a curriculum developer ensure alignment with national dialysis certification standards? A. Review previous course evaluations. B. Reference job descriptions. C. Cross-reference content with current certification objectives. D. Include feedback from one patient. 9. Which method is most effective for evaluating the clinical performance of a dialysis trainee? A. End of semester written test only. B. Self-assessment by the trainee. C. Direct observation using a competency checklist. D. Peer review of verbal responses. 10. What approach best facilitates mentorship in a fast-paced nephrology clinic? A. Weekly group meetings. B. Allowing mens to work unsupervised. C. Scheduled one-on-one clinical debriefings. D. Assigning reading homework only. 11. A dialysis CNA is unsure about using a new electronic health record system. What adult learning principle applies? A. Immediate relevance enhances motivation. B. Long-term goals reduce anxiety. C. Disengagement promotes independence. D. Delayed feedback improves retention. 12. What should a trainer focus on when evaluating a dialysis CNA's communication with patients? A. Length of conversation. B. Accuracy of medical terminology. C. Use of empathy and active listening. D. Volume of voice. 13. Which type of evaluation tool is best suited to assess effective learning outcomes in dialysis training? A. Multiple choice quiz. B. Simulation grading rubric. C. Self-reflection journal. D. Medication dosage exam. 14. When developing a new module on vascular access types, what instructional design step comes first? A. Select assessment tools. B. Draft PowerPoint slides. C. Identify learning objectives. D. Record video lectures. 15. What is the key advantage of using simulation-based training in nephrology education? A. Eliminates need for written exams. B. Allows safe practice of high-risk procedures. C. Replaces all clinical hours. D. Limits instructor feedback. 16. A preceptor observes a trainee missing subtle signs of dialysis disequilibrium syndrome. What mentoring action is best? A. Reprimand the trainee publicly. B. Review signs during post-shift discussion. C. Suggest switching career paths. D. Delay feedback until next quarter. 17. What strategy helps maintain consistency among instructors in a dialysis training program? A. Allowing instructors to use any teaching method. B. Weekly calibration meetings with shared rubrics. C. Permitting only verbal evaluations. D. Eliminating instructor oversight. 18. What is an essential component of regulatory compliance training in dialysis centers? A. Emergency call tree. B. CMS conditions for coverage. C. Vacation policies. D. Staff lunch break scheduling. 19. A student expresses frustration over failing a skills assessment. What mentoring technique is most appropriate? A. Avoid the topic to preserve rapport. B. Emphasize consequences of failure. C. Conduct a focused review session and offer encouragement. D. Assign more paperwork. 20. Which method best assesses whether a technician can respond to a patient emergency? A. Paper-based test. B. Observation in live clinical setting. C. Review of training transcript. D. Oral quiz. 21. An instructor receives poor feedback for a monotone lecture. Which strategy will most enhance learner engagement? A. Increase the lecture duration. B. Add real-life clinical scenarios. C. Remove assessment components. D. Minimize discussion. 22. Which of the following best demonstrates adherence to HIPAA in a training environment? A. Displaying patient names during demo. B. Using de-identified case studies. C. Sharing patient stories publicly. D. Saving data to a personal device. 23. What is the most effective way to teach critical thinking in dialysis procedures? A. Memorization of protocols. B. Role-playing various patient scenarios. C. Matching terms with definitions. D. Giving open-book quizzes. 24. Which principle should guide feedback during a clinical evaluation? A. Delay feedback until the end of training. B. Give only positive feedback. C. Be timely, specific, and actionable. D. Use vague, general praise. 25. Which approach promotes collaboration in a multidisciplinary dialysis care team? A. Rank-based communication. B. Shared decision-making and open dialogue. C. Restricting information to RNs. D. Limiting CNA input. 26. A new dialysis technician consistently bypasses machine alarms. What is the most appropriate instructional intervention? A. Ignore the behavior to see if it improves. B. Reassign the technician. C. Conduct targeted retraining on alarm significance. D. Encourage alarm silencing for patient comfort. 27. What is a major benefit of case-based learning for dialysis students? A. Simplifies compliance requirements. B. Promotes passive knowledge retention. C. Connects theory with real-world practice. D. Replaces the need for preceptors. 28. What is the most effective mentoring strategy for a new CNA struggling with time management? A. Assign more patients. B. Allow tasks to go unfinished. C. Co-create a realistic shift workflow plan. D. Provide a generic schedule. 29. What element is essential in assessing psychomotor skills in dialysis? A. Written summary. B. Peer feedback only. C. Task-specific checklist and observation. D. End-of-week attendance. 30. How can instructors reduce cognitive overload in new dialysis trainees? A. Deliver all content in one long lecture. B. Integrate microlearning modules. C. Use only textbooks. D. Focus on memorization. 31. A dialysis technician in training administers medication without verifying the prescription. What is the most appropriate instructor response? A. Praise initiative. B. Review the 5 rights of medication administration. C. Ignore the behavior. D. Retrain using only written materials. 32. What instructional strategy best supports retention in adult learners with diverse educational backgrounds? A. One-size-fits-all lecture model. B. Incorporation of varied teaching methods and materials. C. Exclusive use of scientific journals. D. Elimination of all assessments. 33. What is the primary purpose of using formative assessments during a dialysis training module? A. Certify skill mastery. B. Assign final grades. C. Provide ongoing feedback to support learning. D. Replace summative evaluations. 34. A CNA asks a complex question during a lesson. What response aligns with adult learning best practices? A. Dismiss the question. B. Redirect the question to another student. C. Encourage discussion and explore the topic collaboratively. D. Avoid going off script. 35. What is the most effective way to mentor a dialysis technician on handling angry patients? A. Ignore the emotional behavior. B. Model calm communication and de-escalation techniques. C. Recommend avoiding the patient. D. Emphasize speed over empathy. 36. Which method is most appropriate for evaluating communication skills with patients who speak limited English? A. Ignore the barrier and proceed normally. B. Require all patients to speak English. C. Use role-play scenarios and assess use of interpreter services. D. Assign written essays. 37. How can training developers ensure instructional content is inclusive and culturally competent? A. Focus on Western medical models only. B. Avoid sensitive topics. C. Incorporate diverse patient case studies and cultural scenarios. D. Use identical content across all regions. 38. What should be emphasized during training on infection control for dialysis? A. Patient social preferences. B. Proper PPE use and hand hygiene. C. Room decoration. D. Machine speed adjustment. 39. How can instructors evaluate if learning outcomes are met after a vascular access lab? A. Give a true-false quiz. B. Observe performance using a skills checklist. C. Ask students to write a poem. D. Conduct a group discussion. 40. A CNA in training mislabels a dialyzer. What is the correct response? A. Ignore the error. B. Correct it silently. C. Stop and review safety protocols immediately. D. Assign a research paper. 41. What communication technique helps reinforce understanding among dialysis students during clinical instruction? A. One-way instructor lecturing. B. Open-ended questioning and dialogue. C. Silent demonstrations. D. Use of medical jargon exclusively. 42. Which is a key indicator of successful mentoring in a dialysis training environment? A. Reduced clinical hours. B. High absenteeism. C. Mentee demonstrates independent problem solving. D. Mentee defers all decisions to the mentor. 43. What approach should a clinical instructor take when giving critical feedback? A. Focus on character flaws. B. Provide feedback privately with a focus on behaviors and improvement. C. Use sarcasm to make a point. D. Avoid the topic to maintain rapport. 44. Which assessment type is best suited to measure clinical judgment in dialysis procedures? A. Multiple choice. B. True-false. C. Simulation with instructor evaluation. D. Matching definitions. 45. What mentoring action supports skill mastery in a newly hired dialysis CNA? A. Occasional observation only. B. Consistent check-ins and feedback loops. C. Full independence immediately. D. Weekly lectures without practice. 46. A dialysis trainee reports difficulty understanding arterial and venous pressures. What is the best instructional strategy? A. Assign additional textbook chapters. B. Use real-time machine data and visual aids. C. Ignore the confusion until the final test. D. Repeat the lecture verbatim. 47. How can instructors address different learning styles in a single training module? A. Eliminate visual aids. B. Deliver content using visual, auditory, and kinesthetic methods. C. Teach only through lectures. D. Standardize all learning experiences. 48. What should be included in a dialysis technician's scope of practice training? A. Physician scheduling duties. B. Advanced surgical techniques. C. Legal boundaries and task limitations. D. Insurance coding. 49. Which of the following best helps identify knowledge gaps in dialysis trainees? A. Listening to patients' stories. B. Conducting a final oral exam only. C. Pre- and post-training assessments. D. Limiting clinical exposure. 50. A patient expresses fear of needles. How should a technician trained in therapeutic communication respond? A. Avoid discussing the concern. B. Provide rushed education. C. Acknowledge the fear and explain the procedure calmly. D. Dismiss it as irrational. 51. Which documentation behavior indicates regulatory compliance? A. Delaying notes until the next shift. B. Using personal abbreviations. C. Accurately charting care in real time. D. Delegating charting to another tech. 52. How should a clinical instructor respond when a student incorrectly initiates dialysis without proper machine priming? A. Allow the session to continue. B. Stop the session and use it as a teachable moment. C. Ignore the error. D. Assign a group project. 53. What key feature should a dialysis training program evaluation include? A. Participant satisfaction only. B. Budget summary. C. Objective measurement of learning outcomes. D. Number of patients seen. 54. What mentoring practice fosters long-term professional development? A. Focus on daily tasks only. B. Provide ongoing career coaching and goal setting. C. Rotate mentors weekly. D. Avoid career-related discussions. 55. Which tool best supports competency-based education in dialysis training? A. Time-based attendance sheet. B. Patient feedback form. C. Skills checklist with performance standards. D. End-of-year celebration. 56. How can a mentor model ethical behavior in dialysis settings? A. Ignore policy violations. B. Prioritize patient safety in all decisions. C. Allow shortcuts for efficiency. D. Focus on peer approval. 57. Which element must be present for effective interprofessional communication in dialysis care? A. One-directional command. B. Independent siloed tasks. C. Shared language and mutual respect. D. Exclusive communication between nurses. 58. What is the most effective way to train CNAs in responding to blood leak alarms? A. Visual demonstration and return demonstration. B. Verbal quiz. C. Theoretical reading. D. Watching a documentary. 59. Which practice supports continuous quality improvement in a nephrology training program? A. Annual review only. B. Reactive updates after incidents. C. Frequent feedback loops and data review. D. Avoidance of change. 60. What should a mentor do when a trainee continuously makes the same mistake despite retraining? A. Ignore the issue. B. Conduct a root cause analysis and develop a remediation plan. C. Immediately terminate the trainee. D. Lower expectations. 61. How can instructors assess trainees' readiness for independent clinical practice? A. Peer popularity. B. Supervisor intuition. C. Consistent demonstration of competencies. D. Number of clinical hours only. 62. What is a core requirement for curriculum accreditation in dialysis technician programs? A. Cost efficiency. B. Course popularity. C. Alignment with industry standards and outcomes. D. Patient testimonials. 63. A dialysis CNA in training consistently uses informal language with patients. What is the best corrective action? A. Ignore it. B. Publicly correct the CNA. C. Role-play professional communication. D. Assign extra shifts. 64. How can instructors foster autonomy in learners without compromising safety? A. Allow unsupervised practice. B. Encourage independent decision-making with guided support. C. Give learners full control. D. Remove feedback. 65. What is the primary benefit of reflection journals in clinical dialysis training? A. Eliminates need for exams. B. Promotes critical thinking and self-awareness. C. Serves as entertainment. D. Delays content delivery. 66. What strategy should instructors use to support a learner experiencing test anxiety? A. Add extra quizzes. B. Ignore their feelings. C. Offer practice exams and anxiety reduction techniques. D. Eliminate all testing. 67. How should a mentor respond to a mentee reporting workplace harassment? A. Ignore the claim. B. Encourage silence. C. Follow organizational reporting procedures and provide support. D. Blame the mentee. 68. What instructional design model is widely used in developing healthcare curricula? A. ADDIE. B. SWOT. C. SMART. D. DMAIC. 69. What characteristic defines mastery learning in a dialysis education program? A. Fixed timelines for all. B. Passive lectures. C. Advancement based on competency, not time. D. Minimum exposure. 70. A trainee is caught falsifying documentation. What is the most ethical instructor response? A. Ignore to protect the trainee. B. Address it in private and report per policy. C. Give a verbal warning only. D. Blame peers. 71. During clinical instruction, a trainee becomes overwhelmed by the volume of alarms. What is the best instructional approach? A. Encourage multitasking without assistance. B. Assign the trainee to another unit. C. Break down alarm protocols into manageable segments and practice with simulations. D. Ignore the trainee's concern. 72. How can instructors promote ethical decision-making in dialysis trainees? A. Memorization of rules only. B. Avoid discussing ethics. C. Integrate case-based discussions and ethical dilemma scenarios. D. Focus solely on technical accuracy. 73. What is the most effective evaluation method for assessing trainees' handling of emergency dialysis situations? A. Group discussion. B. Written test only. C. Simulated code drills with performance rubrics. D. Attendance sheets. 74. A dialysis technician repeatedly fails to properly cannulate an AV fistula. What is the best mentoring response? A. Suspend clinical training. B. Provide focused skill remediation and supervised practice. C. Assign textbook reading only. D. Ignore and reassess later. 75. What teaching method best aligns with the constructivist learning theory in dialysis education? A. Passive lecture. B. Repetition drills. C. Collaborative problem solving using real patient cases. D. Daily quizzes. 76. What is the goal of using return demonstration in dialysis clinical instruction? A. Increase lecture hours. B. Meet checklist quotas. C. Ensure psychomotor skill mastery. D. Eliminate patient interaction. 77. Which factor most affects the reliability of a dialysis training assessment? A. Trainee background. B. Time of day. C. Standardization of scoring and conditions. D. Patient feedback. 78. How should a mentor handle a trainee showing signs of emotional burnout? A. Ignore the issue. B. Recommend time off and offer supportive resources. C. Increase their workload. D. Reprimand them in front of others. 79. What communication approach is most effective in team-based dialysis care? A. Hierarchical instructions only. B. One-way announcements. C. Shared decision-making and open dialogue. D. Silence unless spoken to. 80. A dialysis program is updating its curriculum. What should be the first step in the revision process? A. Reprint old materials. B. Eliminate all former content. C. Conduct a needs assessment and stakeholder input. D. Shorten the training length. 81. What is the benefit of using peer assessments in dialysis technician training? A. Eliminates instructor grading. B. Promotes accountability and reflection. C. Replaces clinical supervision. D. Discourages collaboration. 82. A clinical instructor sees a trainee improperly adjusting dialysate composition. What should they do first? A. Observe silently. B. Stop the action and provide immediate correction with rationale. C. Report the trainee. D. Wait until the post-shift meeting. 83. What best demonstrates regulatory alignment in dialysis training content? A. Based on local rumors. B. Aligned with CDC, CMS, and state-specific guidelines. C. Developed independently by a single instructor. D. Adapted from outdated textbooks. 84. What is the most appropriate way to deliver end-of-rotation feedback to a dialysis trainee? A. Vague written notes. B. Unstructured email. C. Structured in-person meeting with documented goals. D. Group presentation. 85. What strategy should be used to train on preventing bloodborne pathogen transmission? A. Visual art project. B. Online discussion forum only. C. Combination of lecture, demonstration, and competency checkoffs. D. Eliminate all group activity. 86. Which curriculum element ensures the integration of soft skills in dialysis training? A. Ignore non-technical areas. B. Assign only technical readings. C. Include modules on empathy, communication, and professionalism. D. Focus entirely on machine mechanics. 87. What is the advantage of using case-based learning in dialysis education? A. Reduces interaction. B. Promotes rote learning. C. Enhances critical thinking and application of knowledge. D. Avoids discussion. Dialysis CNA Technician Certification. The Dialysis CNA Technician Certification is a specialized credential for individuals assisting with kidney dialysis treatment in nephrology centers. This role combines CNA-level patient care with technical knowledge of dialysis equipment and procedures. Training programs typically include coursework in kidney function, fluid and electrolyte balance, infection control, vascular access care, and dialysis machine operation. Candidates must complete hands-on clinical training and pass a certification exam, such as the Certified Clinical Hemodialysis Technician exam. The exam evaluates understanding of dialysis principles, patient monitoring, and emergency response during treatment. Certified dialysis CNAs technicians play a vital role in supporting patients with chronic kidney disease, ensuring safe and effective dialysis care. Here are the top 5 beneficial uses of dialysis CNA technician through nephrology center-based training and certification. 1. Specialized expertise. Certification equips CNAs and technicians with the knowledge to assist with hemodialysis procedures, monitor patients, and maintain dialysis equipment. 2. Career advancement. Certified dialysis personnel are eligible for roles in nephrology clinics, hospitals, and chronic care settings, with potential for higher pay. 3. Patient impact. Trained professionals support life-sustaining treatments for patients with kidney failure, improving patient safety and comfort. 4. Clinical confidence. Hands-on nephrology training builds competence in fluid balance, infection control, and emergency response during dialysis. 5. Professional recognition. Certification validates the ability to work in a highly regulated, specialized healthcare field, opening pathways to further renal care credentials.